And now, the Dr. Harry Fisch Program, a show exclusively for men's health issues, where no topic related to men's health is off limits. The Dr. Harry Fisch Program is here to keep you operating at peak performance. From the boardroom to the bedroom and everywhere in between.
The doctor will see you now.
Here's Dr. Harry Fisch.
Hey, welcome back to the Dr. Harry Fisch Show. This is our second hour. Remember, this is our America's only men's health show. Can you imagine? We've never had a men's health show. This is the first of its kind. You want to learn more about men's health? Prior shows, interesting stuff. ManUpAboutHealth.com. ManUpAboutHealth.com. We have launched it, so we're going to be really getting more and more into it. We'd love you to visit that site. But now we have a special guest. I got to tell you, we have a plastic surgeon here who's going to join us, Dr. Adam Schaffner, who's from New York. He's a fellowship-trained New York City plastic surgeon, specializes in surgery of the face, breast, and body. Quite interesting that he did plastic surgery and head and neck surgery as well. He's going to talk about some chin implants, which is quite amazing. Apparently, more people are getting chin plants to look younger, and particularly for video conferencing. Adam, are you on the line?
I am. It's great to be with you.
Great to be with you. Adam, where do you operate in New York?
I'm at Lenox Hill, Manhattan Eye and Ear, New York Eye and Ear, and the Center for Specialty Care. We also have an accredited surgical facility in our offices.
You do know I operate at the Center for Specialty Care.
Absolutely.
You know, I haven't seen you there, but I'd like to say hello to you there.
It would be a pleasure.
Now, I do the urology there, all right? I do all the vasectomies, vasectomy reversals, varicoceles, that sort of a thing.
Absolutely. Well, certainly we have patients who are interested in those things, and those are very important procedures.
I love the center, by the way. So tell me something, Adam. You want to talk about the chin plants, right?
Well, chin implants are something which we're seeing a great increase in popularity, and I think a lot of it has to do with the realization when people notice their jaw lines in the mirror, they notice it in photographs, and more recently, they're noticing it on social media, whether it's Facebook or other forms of social media. They're noticing that their jawline may not be as strong as they would like it to be, and strong jawlines are really a signal of strength. If you look at heads of state, heads of companies, over 90% have strong jawlines.
That is interesting. I didn't know that.
Yeah, absolutely.
That's why I'm never going to be a CEO. I'm looking at my neck right now. I don't even see a jawline. What happened to my jawline?
You know what? That's an important point as well, and that has.
Do I have a jawline? Hold on, Adam. One second. Do I have a jawline, guys? No, you're fired. She's fired. My assistant is fired. I don't have a jawline. Just lie to me. Do I have a jawline? I got a jawline. She's lying to me. Yeah, what happened to my jawline? I need to lose weight, right? Adam, can I liposuction it before I get a chin implant?
Well, that's a great question. So, and it really depends on the individual. Sometimes jawlines were never really sharp, even from young childhood. Sometimes it's something that as you gain weight, you sort of obliterate the sharpness of that jawline, and things like diet, nutrition, exercise are coming into play. And then you can consider liposuction to help sharpen those jawlines. And then alternatively, there are surgical procedures which address not just the soft tissue like liposuction, but things like chin implants and other types of surgeries which help to strengthen the bony structure.
Tell me about that. A chin implant. That means the chin is like Jay Leno's chin.
Well, Jay Leno has an overly strong chin.
Right.
What happens if you take someone who has a weak chin and doesn't want to be as strong as Jay Leno, but wants to be stronger to give them a better jaw and neckline?
Well, let's face it. We saw a lot of people that it looks like they're missing a bottom jaw, right? They're missing a chin.
That's exactly right. And you'll be looking at them on the subway or when you're ordering a sandwich at the deli, and you'll look over and you'll be like, okay, there's not enough balance in the face because the lower third of the face looks weak, and that's where a chin implant can be very helpful.
But there's a lot of chins in Chinatown, right?
There are a lot of chins everywhere, but certainly people have...
Adam, that was a great joke. Come on.
It was a great joke. I was trying to be politically correct. That's a loaded question. And the fact is that, if we look at our Asian friends and colleagues, certainly a lot of Asians do have weak chins. And in fact, the South Koreans have pioneered a lot of work in that as far as their plastic surgeons are concerned. But there's no doubt that...
But Adam, this can't be a big part of your practice. Chin implants, is it?
Absolutely. It's becoming a much bigger part of the practice. Absolutely.
Yeah, but it's got to hurt, right? You put a chin in there?
Surprisingly, it does not hurt, in any great way. And I can only tell you from what my patients have told me, it's a small incision, either right underneath the chin, hidden from public view, or inside the mouth. You place the chin implant just on top of the bone, and we generally put it on top of the layer that's over the bone called the periosteum, which I know you know well. And because of the fact that you're not really touching that layer in a great amount, it's something which patients really say, it feels sore. They feel the pressure because of the fact that you're increasing the volume in that area, but it's not really a big, significant pain.
Let me ask you this. If you don't mind, let me just change the topic for 1 second. I have a friend who got like 18 hours of plastic surgery, liposuction, this, that, all to look good for a bar mitzvah. So the kid was 13, now the kid is 15. 2 years later, she gained all the weight back. How often do you see people gain the weight back, after liposuction or anything like that?
Unfortunately, it is a common occurrence, and I think a lot of it is because of the fact that people think that if they've had liposuction that they can't gain the weight back. And I think what's important for people to understand, and this is really important in the preoperative counseling, is that people need to know that when you do liposuction, you remove those fat cells, but that doesn't mean that you can't gain weight. For those fat cells that are still there, if you go ahead and eat too much or have too many calories and don't burn them off, you're going to go ahead and gain weight.
Adam, I want to keep talking to you, but before that, I want to mention do you have a website that you want people to get a hold of you if they need to get a hold of you?
Absolutely. If people have questions, they can go to drschaffner.com. That's www.drschaffner.com, or call 212-688-6600.
Let me ask you a question, Adam. Men, what percent of the practice are you seeing on men?
About 10 to 15% of my practice is men who are desiring cosmetic or aesthetic plastic surgery, and that's pretty much consistent with what's going on nationally.
Okay, of the men that come in, what percent are gay?
I'd probably say 20 to 25%.
Really?
Yeah, in my practice, yeah. But 75% of the men that I operate on are heterosexual males. And
I just wanted to make a point that the heterosexual, people want to get plastic surgery. And the number one plastic surgery for men would be what?
Well, it really depends on the area of the country that you're in. Male rhinoplasty or male nose jobs is certainly very popular. Liposuction is very popular among men. People who are in towards the 50s and 60s desire rejuvenation of the face and the upper eyelids. So really all of those are very popular among men.
Yeah, I'm looking at my eyeballs right now. My eyelids look like I look like I'm a chin. Right? Oh, you like that? Oh, Adam laughed. Oh, we got Adam to laugh.
I can laugh a lot, my friends.
Adam, did you ever, when I'm in the operating room at the Center for Specialty Care, ask the nurses what it's like when my cases are going on? Particularly, I'm doing 3 cases this Thursday. Are you going to be there this Thursday?
I will actually be at another facility this Thursday, but I will be sure that we connect at some point.
I got all the cases over there. What about Botox for men?
Well, Botox is extremely popular, and one of the main reasons is that men are oftentimes looking very intense. They look like they're deep in thought, and sometimes it can make them look angry. And I'm specifically talking about the number 11 in between the eyebrows, what we call the glabella region, or the forehead lines, which can oftentimes make people look very surprised or angry. And so those are some very common areas where men will get Botox.
We call that the mark of the maven.
Mark of the maven. Some people are nicknaming this Brotox for men, and I know on a previous show, you had nicknamed it something else related for urology, but certainly men are definitely interested in Botox.
Adam, let's face it. We have an application. If you put Botox in the prostate, we're using that in the bladder for overactive bladder. Men who go to the bathroom too much. The side effect is it takes the wrinkles out of the scrotum.
That's what I've heard.
And then we're calling that Scrotox.
Absolutely. Alex Baldwin did a great Saturday Night Live skit on it.
They did one like that?
Absolutely. You can find it on YouTube.
Oh, I thought I made it up. Look at that. They're stealing my material.
I'll let that between you and Alec Baldwin to see who's stealing whose material.
Scrotox. I love that. You got to love that.
Absolutely.
Now, let me ask you one more question. What about men? Did you ever men come in and say one testicle hangs lower than the other?
Not to me personally, but I'm sure that people have noticed.
The reason I say that is because I see a lot of men who have one testicle longer than the other. I mean, hanging lower, low-hanging fruit, if you will. And what's interesting is I do a lot of varicocele surgery. That's I correct the veins in the scrotum. And the scrotum actually goes back up to normal position by doing that. And this fall, we're going to have an article in Esquire about how to correct low-hanging fruits. I was doing some research on it. I did it by accident. I found that because of my all the surgeries that I've done. But there are plastic surgeons that actually do genital surgery.
That is very true, becoming very popular. It has to be done with the right patient and have the appropriate expectations, but certainly some men are desiring increased length and girth. That's something that I think that you have expertise to comment on most certainly. And then there's a lot of women, especially who have delivered children, who have noticed changes that they're not happy with, some of which are external, some are internal, and both of which can be corrected.
Yeah, I don't know. That's but most plastic surgeons don't get into that, right?
It's not very common for plastic surgeons to get into that. There are some individuals who are trained in both urology and plastic surgery, or gynecology and plastic surgery, and they're really the most expert to be performing those types of procedures.
And let me ask you, what plastic surgery do you like doing the best? I mean, I like certain, we all have procedures that we like better than others.
Absolutely. Well, I did 2 fellowships, one in facial plastic surgery, ironically with the person who developed one of the most popularly used chin implants. So facial rejuvenation is an area of expertise of mine. And then the other is breast and body contouring. I did a fellowship at Georgetown with one of the individuals that designed a lot of the currently used breast implants. And in our office, in our accredited operating room, we're able to do what's called rapid recovery breast augmentation. And we do it in a very precise manner. It's done with minimal discomfort postoperatively, and the patients, most importantly, don't have to go under general anesthesia. They only need to have IV sedation. That means that all the risks associated with general anesthesia are taken out of the picture when you're doing that type of procedure.
That's pretty good. Any men getting breast implants?
Not breast implants. We do have some men who desire pec implants, and more commonly men who have man boobs or gynecomastia, and we're helping to improve those as well. So
we're trying to change the name from man boobs to mitts.
You know what? You may get some bites on that one. We'll have to wait and see if it takes
What
off.
about butt implants? I heard people getting butt implants.
They are, absolutely.
Tell me the truth. That's got to hurt, man.
That butt implants, when it's done with a silicone implant, is an uncomfortable recovery period to have. As far as buttock augmentation using fat grafting, otherwise known as a Brazilian butt lift, that's something where the recovery is very minimal discomfort, and people do very, very well.
I love this. Let me just ask you a quick question. Last question, if you don't mind. Let's say a lot of people don't have plastic surgery, but they're talking to a plastic surgeon. What can they do to look younger?
Well, there are a lot of things. It really depends on what bothers them. They can, first of all, start by minimizing sun exposure, using sunblock as far as prevention. If it's fine lines and wrinkles, things like Botox, fillers, and lasers can be beneficial. There are lots of things of chemical peels and skincare products that can help. There's using one's own fat to help fill out areas that have become hollowed with age. Suffice it to say, there are a lot of things that are out there that do not require surgical procedure in order to improve one's appearance.
Adam, listen, thank you very much for joining us. Now, let's hear it again. So it's Adam Schaffner at www.doctor, that's Dr. Schaffner, SCHAFFNER.com, right?
That's absolutely correct, or call 212-688-6600 and be happy to answer any questions.
I love it. Adam, thank you for joining us today. I really appreciate it.
Thank you.
I'll see you soon at the surgery center.
Look forward to it.
All right, take care. Bye-bye.
Take care.